In the last few years, the number of people managing their own care through personal budgets has continued to rise. But personal budgets are much less common for people with mental health problems. In this film, we look at the work of Stockport Council and Pennine Care NHS Foundation Trust, which have enabled hundreds of individuals with mental health problems to access self-directed support. We'll see how it can be used to provide innovative support in challenging cases. Some would see the approach as bold and unusual. The local authority has approved the use of personal budgets for expenditure on holidays or to start a social enterprise.
In 2000, 2007, 2008, the service was very limited. We were probably very good at medication, at the medical side of services. We were relatively good at the talking therapies and the psychological treatments. We got increasingly good at risk management because we didn't want any more inquiries. What that created was a very risk-averse agenda. So we tried to balance the medical and the psychological with the social, with the recovery, and move away from this risk-averse practice which just restricted people and begin to take positive risks.
In 2009, Stockport launched a pilot to enable people with mental health problems who might be considered high risk to access a personal budget, known as self-directed support. When positive risk-taking is encouraged, staff can come up with innovative ways to support people.
The vast majority are doing something very different with their money. So we've come a long way from when we first jumped in at the deep end. By jumping in, we managed to find the solutions because we had to do, and we're in a very strong, healthy position now.
A holiday in America gave a boost in confidence to Jenny, who has bipolar affective disorder. She used her personal budget to fund the trip, and the outcome was positive. Jenny's now back in education. Since her holiday, she's started a college course in travel and tourism. Jenny also volunteers once a week at the mental health team office.
I get very nervous about travelling and doing new things and meeting new people, and flying is a big fear of mine. So I was hoping that when I applied for self-directed support, if I got given it, that I would be able to overcome some of these fears and boost my confidence.
Carmel Bailey is the social care lead in the Stockport mental health team.
What are you up to? Have you got them pictures yet?
I
the
do.
Holiday?
Of
You do?
my trip to America.
It seems ages ago.
Here they are. It's gorgeous. That road went on for miles and miles and miles. I loved being out there in the desert.
We tried not to look at what she was buying with it or what the object was, but what the aims were for her and what it would mean for her. And that was about her having a separate identity from being with somebody who had a mental health problem and moving on from that so that she became more and more integrated into the community and was seen as a person in her own right, that mental health problem might be there somewhere. And that has definitely worked with the package that she's had.
For Jenny, being awarded a budget to plan a holiday has played a big part in helping her take control of her life.
I'm looking to the future now and looking at getting a full-time job in the next couple of years, which is not something that I really ever thought I'd be able to do. And I've talked at a conference about self-directed support in front of a room full of people, which was terrifying, but again, something that I felt had improved because of this holiday that I got.
The way the payments are made vary on an individual basis, but generally they're put into a bank account in the service user's name.
What people have bought is stuff that really helps them belong into the community, which gives them that social inclusion. So it might be education, it may be leisure, maybe transport, it may be personal assistance. They haven't gone wild and, gone buying ridiculous things. They've bought things which actually meet real, genuine outcomes for them.
Jerry, a former paramedic who has post-traumatic stress and depression after a violent incident on duty, used his personal budget to develop his interest in photography.
When he came to us, he was keen to get involved in some of the group work that we run in the team and got involved with the Painting with Light photography project. And they're now looking at developing a social enterprise. And all this has come about following his STS package. He's bought photography equipment with it and is looking to use it for developing the social enterprise.
It made me think about what I wanted to do more, whereas I'd quite happily, trod along doing what I needed to do to get right. But this has given me an idea to do it myself, and it's things I wanted to do, not what other people have wanted to do. So it's helped me in that respect.
Staff in Stockport believe this creative approach to support will improve long-term outcomes for Jerry.
He's less likely to relapse. If he does relapse, he knows where his support networks lie. And hopefully, as the business progresses, he will become more and more self-sufficient financially as well as emotionally.
Brian is 50 years old and has depression as well as an alcohol-related medical condition. Though he cannot manage his own budget, Brian is supported to control his own care with the help of his sister and supported living team manager Barry Tildesley.
How are you? I'm all right, don't come in, mate. Oh, thanks.
Brian's self-directed support funds regular visits from support workers who help Brian with cleaning, shopping and managing his finances.
As part of the support team, we realised that Brian was starting to use alcohol excessively. This created problems for him managing in his own home, and obviously his behaviour then became a little bit more unmanageable and impacted on the local community. At that point, we had to take quite a drastic decision in terms of getting support in very, very quickly. Otherwise, the alternative for Brian could have been custodial sentence or remand.
The use of self-directed support enables a flexible approach where additional care can quickly be put in place in times of crisis.
There may be times that you may become unwell or you may start using alcohol, and we felt that we should build in some contingency plan for that.
This adaptable approach to funding Brian's support has helped create stability in his life.
For Brian, at the moment, he has got aspirations about undertaking voluntary work in the future and getting more involved in his community. And for him, it's a positive experience. And without SDS, I don't think he'd be able to manage by himself in his own home. Well,
I'm able to make my own decisions to some extent, but I tend to be given prompts which I accept more often than reject. But I'm still able to say, well, I think this is a better idea. So I'm given my own way on certain things, but I do accept that there are positions and circumstances where I need the help and the advice of the team, and that's what I get, and I accept that and appreciate it.
Risks and safeguarding are considered at a core group meeting. Today, Brian's case is being discussed. An advocate for the service user is invited to the meeting. The fortnightly meeting sees professionals from across social care discuss any concerns or risks associated with personal budgets and support plans.
He feels that he doesn't need as much support, and that is that our own in-house services have now withdrawn the evening visits because he's been so well. He hasn't drank for about 4 months.
Brilliant.
Creating an environment where staff talk openly about risk has been the key to success in Stockport.
I can't overstate how difficult this journey was to begin with, to take clinicians and practitioners with us on this journey. So we had to be able to put in place a safeguard around the practitioners. We've got a core group and we have a risk enablement panel. The risk enablement panel in 3 years has only met twice. We had to have it to reassure staff at the beginning because they were very frightened, some of them, about what might happen if things went wrong. And I'm pleased to say nothing has gone wrong. But what we have got is some very positive outcomes.
With around 350 people with mental health problems currently on a personal budget in Stockport, managers see the benefits in the change in the way the services are delivered to people.
People with mental health problems can often feel very powerless in a system, and that is a self-reinforcing cycle that is not good for their health. By giving people much more control over the money, control over the commissioning generally and their own individual situation, then I think the opportunity to flourish and grow is tremendous.
Instead of maintaining people at some expense, we can help them to become contributing citizens, and people have gone on to get jobs and employment out of services as a result of a kickstart that personalisation gave them. Just a small amount of money can transform somebody's life. That's what we found.